Have you ever noticed a swelling or lump in your body and wondered what it could be? Is it a hernia or a hydrocele? These two conditions might seem similar, but they're quite different when you dive into the details. In this video, we'll explore the differences between a hernia and a hydrocele, focusing on how to identify them, how they're diagnosed, and the best treatments available. Stick with us if you've ever been curious about these conditions. What is a hernia? A hernia happens when part of an organ or tissue pushes through a weak spot in the surrounding muscle. The most common type is an inguinal hernia, which occurs in the groin area. Hernias can be caused by increased pressure within the abdomen due to obesity, age, or lifting heavy objects. How do you know if you have a hernia? Typically, the first sign is a visible bulge, especially when you cough, lift something heavy, or strain. This bulge might come with discomfort or a burning sensation. Though some hernias are painless, untreated ones can cause serious complications like strangulation, where the blood supply to part of your intestines is cut off, leading to extreme pain and requiring surgery. Signs of a hernia include a bulge that may become more visible when you cough or bend over. The mass might feel soft and could even be tender to the touch. What is a hydrocele? Now let's talk about hydroceles. A hydrocele is a condition where fluid builds up around the testicles, causing swelling in the scrotum. This condition is common in newborns but can also affect adults, particularly older men. Unlike hernias, which involve organs pushing through the muscles, hydroceles are filled with fluid. The swelling is soft and can fluctuate in size, usually getting larger during the day. If you notice swelling in your scrotum that's soft and painless, it could be a hydrocele. While they don't usually cause pain, hydroceles can cause discomfort if the swelling becomes large enough. Key differences between hernia and hydrocele. So, how can you tell the difference between a hernia and a hydrocele? Although both involve swelling, they have distinct characteristics. A hernia is when part of the intestine or another internal organ pushes through a weak spot in the abdominal wall. This swelling is usually visible, especially when you cough or strain. In contrast, a hydrocele involves fluid collecting around the testicles, causing swelling that's soft and changes size throughout the day. One of the key tests doctors use to distinguish between the two is called transillumination. When a light is shined through a hydrocele, the fluid inside glows, while this doesn't happen with a hernia. Another important difference is that hernias tend to reduce or disappear when pressure is applied. Hydroceles, however, remain soft and don't shrink when pressed. Additionally, hernias often cause more pain and discomfort than hydroceles, which are typically painless. So, if you have swelling in your abdomen or groin that becomes more noticeable when you cough, it could be a hernia. If the swelling is in the scrotum and is soft, it's more likely to be a hydrocele. How are hernias and hydroceles diagnosed? To diagnose a hernia or hydrocele, doctors first perform a physical exam and ask about your symptoms. For example, a bulge in the groin area that gets bigger with coughing or lifting suggests a hernia, while soft swelling in the scrotum points to a hydrocele. Doctors may use ultrasound to confirm the diagnosis and determine the size and location of the swelling. If needed, further tests like X-rays or CT scans may be done to rule out other conditions. Treatment for hernia. Hernia treatment typically involves surgery to repair the weak spot in the abdominal wall. There are different surgical options, such as open surgery or laparoscopic surgery, which uses smaller incisions for quicker recovery. Recovery from hernia surgery is generally successful, but following your doctor's advice is essential. Although rare, hernias can recur after surgery, so it's important to take proper care. Treatment for hydrocele. Hydroceles are typically treated with surgery, especially if the swelling is large or causing discomfort. The type of surgery depends on the size and nature of the hydrocele. For children, an inguinal approach is often used, while adults may need a scrotal or sclerotherapy approach. In some cases, a less invasive treatment called sclerotherapy is used, where fluid is drained from the hydrocele and a chemical solution is injected to prevent the fluid from returning. However, this method has a higher chance of recurrence, and surgery is often recommended as the best option. To sum it all up, hernias and hydroceles may look alike at first, but they're actually quite different. Hernias involve the bulging of internal organs through a weak spot in the muscles, while hydroceles are filled with fluid around the testicles. The good news is that both conditions are treatable, and early diagnosis is key to avoiding complications. If you notice any unusual swelling or discomfort, it's important to see a doctor who can properly diagnose and treat the condition. If you found this video helpful, make sure to like, share, and subscribe for more useful content. Stay healthy, stay informed, and take care.